Hi, today I prepared for you a small routine for people who has chronic lower back pain constantly, and it's very difficult to move for them. And this is the simplest exercises you can do to help to reduce the tension and discomfort in your lower back. First, I want you to place and get 4 points kneeling position, your hands under your shoulders and your knees under your hip joints. And if you feel a tension in this position, like in this 90-degree on your wrist, so you can move hands a little bit in front, so it will be decreased angle and decreased tension. And I want you to get neutral alignment for your pelvis and for your whole spine. So we want to feel that the front of the pelvis, checking your bones here, it's parallel with the floor. You have little extension on the lumbar spine, little flexion on the rib cage, and your head and neck in line with your spine. So what we want to avoid and see this when you're sinking down, because the gravity pushing you, you have to resist and then push yourself away from the floor. Same with lower back, so we don't want to collapse it, or we don't want to start with the round back position. So it's in the middle, not arched, not flexed, just nice neutral alignment. Breathe in, and we want to flex now. You're tilting pelvis backwards and you're flexing gently spine, bone by bone, dropping top of the head down, look at your pelvis. And then from tail to head, you're returning back to neutral alignment. Just to neutral, the way you start, and again, dropping, tailbone, flex, flex, flex. Every single bone, try to feel it, look at your pelvis, and then return back to neutral. Very good. And again, we're doing bone by bone, from the bottom of the spine to the top of the spine. Push the middle of your back up toward the ceiling, like you're hanging from the ceiling from that point, and return to neutral. Very good. And now I want you to move on the lower back and pelvis. This is your neutral. You have little arch in the lumbar spine, and then you tilting slightly pelvis and lower back into flexion, and return to neutral. Inhale and exhale. A very small movement, but it's really good and helping to release the lower back muscles, cramping, tension. So when you feel the pain, it's a muscle pain. We need to put the more blood in those areas. That's why we're moving, contracting, releasing, contracting, releasing. That's how we're making a blood supply in this area. Very good. And now I want you to stay still in the lower back and pelvis position, but move hips and knees and shoulders and return. The goal is to maintain stability on your lower back and increase mobility on your hips. Usually people who has a lower back pain, they have a tight hips and tight hamstrings. So here we're stretching your glutes, back of the hips. It's very, very important. Increase mobility of the hips, because you're losing mobility when you have lower back. You mentally protected constantly that area, and you stop moving properly hips, and lower back start moving a lot. That's why you're getting more pain from unstable position for the lower back. And we're training now how keep neutral back stable without movement when you're moving hips. Very nice. Nice, beautiful. Okay, and now we want to move flat, but keep again lower back and pelvis very stable. Shift to the one knee, the weight, extend leg, then lift as far as you don't feel that you're rotating whole pelvis with the leg. Then you're reaching opposite arm forward. Stay 1, 2, 3. Return hand, return leg. Very good. Shift weight to another knee. Pelvis still neutral, square, not rotated. Reach leg first, just to hip height, no need higher. And reach arm just to hand to shoulder height. And return. Very good. And let's do it a little bit faster. Breathe in, stay Stretching arm and leg simultaneously. Reach, return, very good. Inhale and exhale again. Reach. This exercise strengthening again your small back muscle stabilizers, which are holding your vertebrae between each other. Very good. And now it's also your oblique system. Perfect. And let's do one more time, 2 times. Exhale. Beautiful. So you're not changing your spine position and pelvis. They are always neutral. Very good. And return. And let's sit, walk back. And I want you to keep neutral position again as much as possible. Very good. And we want to now lower elbows down to your spine and a little bit round position, but try to keep it not too round, so I don't want you to do that. And we're going to rotate your rib cage. Again, the rib cage can be very stiff when you have lower back because the body wants to just not to move everything, and you're just lifting eyes toward the ceiling, elbow toward the ceiling, and carefully return. Beautiful. And use another side. Just rotate. Look up as far as you can, and remember, when you have pain constantly, you need to still exercise as far as you maybe level of pain like 2, maximum 4, and return. And let's do it again. I want you to repeat each exercise 8-10 times, and we want to now move forward with elbows and lying down on your side. Carefully just lying down. Bring one hand under your head and bring legs closer to the chest. It's called tabletop position, 90 degrees on your hips, and I want you to lower head down like you're in your bed. And this arm you're reaching forward. Lift arms toward the ceiling. This top arm toward the ceiling hand. And then don't move shoulder, but move the rib cage. And feel nice stretch in the lower back. Rotation of the rib cage. Little rotation of the lower back. Inhale, stay. Exhale, stay. Very good. Inhale and exhale, return all the way back. Very good. And again, inhale to lift. We don't want to move knees. We don't want to move pelvis. Pelvis very stable. This bone facing up, and you just rotating your spine. And exhale again. Rotate. Very good. And exhale. Return. And let's repeat one more. In. Up, and then your gaze just fall in your hand, so it will be, your whole spine will be rotated. Your neck also, neck very related to your lower back, and return. And let's do from another side. Same, roll down on your back carefully, and then change side. I'm placing hand under my head, the hips stacked above each other, shoulders stacked above each other, this arm parallel with floor, and I'm lifting on the arm and rotating slightly chest, and then keeping knees together, pelvis without rotation, just rotate spine from bottom to top like a spiral, and you're not collapsing the shoulders, so you're keeping one line, chest and arm. Inhale, stay. Exhale again, stay. Use gravity as a device, as your support to increase rotation of the rib cage. Inhale and exhale, return all the way forward. And again, in. Exhale, feel from the bottom of the spine movement. Look at this hand on the top, in. And exhale, rotate further if you can. And exhale, return all the way back. And to be even, let's repeat one more time. Inhale. And exhale, very good, and exhale again, rotate, inhale, and exhale, return all the way back. Perfect. Lying down now on the back, And we want to check the pelvis. I don't think many people knows how the pelvis rotated. Usually when you have lower back pain, you're compensating and pelvis rotated. So let's place and check, placing your hands on the top of the pelvis and try to feel, is it any side higher than another one? So if, for example, my right side higher, I'm just stretching my left leg and placing another leg also to straight position, but I know that my right hip higher, I am bending this right knee, opening to the side, returning again, knee up and return. So I'm sliding my feet, I'm not lifting foot from the floor. This can be very challenging for the lower back and for the hip flexors. That's why we want to slide to release it, because we need to release those muscles which pulling your pelvis to another side. Very good, and return. And I want you to do it 10 times, 12 times, that stretch. So that stretch will be pulling your pelvis to another side. Perfect. And the last stretch for today, we're going to stretch your glutes. Again, breathe in. You're lifting one leg to the chest and placing as much as you can forward. This exercise, with this exercise, you will stretch the glutes. Hold 5 seconds. Lower foot down. Slide it back. Change leg. Pull it. Inhale. Exhale. Pull knee to the chest. 1, 2, 3, 4, 5. Good. Lower foot down. Release. And let's repeat again. So I'm going to show only 4 times, but you will be doing 6, 8 times for each knee, for each side. Very good. Lower foot first, then slide. Sometimes even lift foot off the floor. It can be challenging. Even lying down on the floor for sacrum, it can be challenging. That's why we're doing only 1, 2 stretches, no more. And return. Very good. Lower foot down. Bend both legs. Roll on your side. And push yourself to the kneeling position. This is your routine. Very simple, but very effective.